The KUM News Zoom room, Guam Memorial Hospital Administrator Lillian Posadas. Thank you for joining us, Lillian.
Good morning, Lillian. Unmute.
Unmute.
Sorry about that.
No
Oh, no.
problem.
He's a pro.
And good morning.
Good morning. Not so good on your end, in your neck of the jungle. We got the announcement late last night. 3 COVID-related fatalities. So thank you for making the time this morning to come on. And if you could, we'll just start there, Lillian. What additional info can you provide us about these 3 COVID-related fatalities?
Well, the first one early yesterday morning was a 50-some-year-old female individual. Let me just make sure.
Right.
There's
Go
so
ahead,
much
get ready.
information.
Good, yeah.
It's just really hard to keep track. There's just so much information going through. And so, okay. Yes, it was such a sad day yesterday. 3 in one day. That's the most we've had in terms of losses, loss of life with the COVID. And yes, the first individual was a female individual who was in the hospital for a while. Gosh, give me a moment here. In the meantime, our COVID census this morning is at 26. And of the 26, 9 of them are on ventilator support. 9 of them are ICU level. And of the 9, 6 of them are on ventilator support. So that's where we stand. We do have a couple of individuals in the emergency room waiting. They're not COVID though, they are PY. And one of them is an ICU, but non-COVID ICU. We also have 4 individuals in-house who are non-COVID, but they are ICU level of care. And so, we continue to receive, as I mentioned yesterday, we continue to receive individuals who need non-COVID hospitalization. So the first one in the morning, I believe, was a 53-year-old. Oh gosh, it's really hard to keep track. Number 43 yesterday was a 53-year-old male individual who came into the hospital on August 30th. Came in from GRMC and had multiple underlying health conditions, diabetes being one of them, and a kidney condition. And then we had the other individual who was a 70-some-year-old male individual who's been in the hospital for quite some time, since the 29th of August. And he also had some underlying health conditions, and he came in really hypoxic. His respiratory system was quite compromised by the COVID. And then the other one last night, sorry. It's just so sad to see, these individuals succumb to this infection, and our condolences and our prayers to the families who have lost their loved ones. Okay. Then the last one, last night as of 6:58 p.m., a young individual, young female, who apparently was having some abdominal symptoms. But by the time they called the EMS, she had already become breathless and pulseless. So they initiated CPR and was en route to the emergency room. They continued the resuscitative measures. And also in the emergency room, several cold blues, resuscitative measures on the individual. And unfortunately, our clinicians just could not save her anymore. She tested positive when she was brought into the emergency room. So those are the 3 fatalities that are COVID related as of yesterday.
And then just touching back on the census, Lillian, you said 26 hospitalized.
26 today. As of today, there are still 26 individuals in the hospital. Yes. Who are COVID positive.
The Joint Information Center last night reported 28.
Well, and maybe we had some discharges, and then we had that one death last night as of 6:58, 7 p.m. So I don't know exactly what time JIC was released.
It was late.
Yeah.
Yeah, it was
It
late.
was way
It was
past
like,
that
yeah,
7
like
o'clock.
10,
Yeah.
9:30 or so. Yeah.
Okay then.
Yeah.
So
So there's
there
been
may
no
have been-
no other people that have passed away.
we've had no, just those 3 yesterday, and we've had some discharges, which is it's a good sign that there are people recovering.
Have you had any people discharged who have then later on had to have been readmitted to the hospital? Because we heard about one.
We've had a couple. Yes, we've had a couple who have come back in. So
Can you tell us any
Yes.
more info on that? So what happens when they get discharged? They're doing well, and then
they were stable. Their oxygen level has been stabilized. One of them, who I know, came back, started having some respiratory symptoms, and came in. The oxygen level was quite low in the 80s, so he was admitted for several days, received some oxygen supplement, stabilized again, and so was released home just recently. We do have another individual who was discharged, came back in after several days, probably a week's time. The clinicians repeated the COVID test, and, a good sign, the individual's test results came back negative. So the individual cleared and, has resolved the COVID infection.
Lillian, how's morale?
How's the morale?
Yes, how's
In the
morale?
hospital? Well, again, we are saddened by all these, fatalities, all these deaths, but we have to continue taking care of those who keep coming in, whether it's COVID or non-COVID. There are still individuals who need the care and the services, so we just have to keep providing those services.
So Lillian, when we get a COVID patient and they go on the ventilator, I mean, I don't expect you to have any precise numbers, but what's the survival rate of these COVID patients once they go on the vent?
It's been really low. It's just been, not a very good indicator once they're on the ventilator. The only one person that I remember who was on a ventilator and fully recovered and was discharged, and that was during the first wave, back in March, when the individual was admitted and was on the ventilator for a while, and recovered, was extubated, meaning the tube that was connected to the ventilator was removed, and went home, healed and fully recovered. So far, that's the only one I can remember, I can recall. But most of the ones in the second wave on ventilators have really, really severe hypoxic and compromised respiratory system. And so, yeah, the survival rate has been quite low.
Can you explain what is hypoxic?
Hypoxic meaning your hypo is low oxygen. You're not adequately getting oxygen into your lungs. Your lung tissues and your lung cells are so compromised by whatever fluid buildup or whatever the infection that's going on in your lungs, and so therefore that oxygen is not coming in and reaching, throughout all your cells in your lungs, and then so your oxygen level in your lungs and throughout the rest of your organs are not adequately getting the oxygen that you need, and it should be at least over 90%, 93% oxygenation is what we normally, have within our system, within our lungs. Hypoxic is then when you're below that 90% level of oxygenation.
A couple of the fatalities, you had said that one of them was in the hospital since August 3rd, another one since the 29th of August. I mean, this is 2 months.
August 30th.
August
That was
30th.
August 30th.
Okay, so about a month each, right?
What's that?
About a month. They were both in the.
Yeah.
Yeah.
Yes. Mm-hmm.
Is that pretty typical for some of these fatalities? Because then again, we see some of them where they're coming into the ER and they're just dying on the same day.
Yeah. It just depends on their conditions. Remember the first gentleman in this wave? He was a young gentleman, 33 years old. He was here for over a month and was on the ventilator for about 4 weeks or longer.
We had asked,
Yes.
I think I had asked you a few weeks ago if there were any pregnant COVID positive patients at GMH. Can you give us an update on that?
What we've had, and fortunately, they delivered their babies. Their babies were monitored as POI and they were tested. And all of those newborn, the results came back negative. And so, it's been successful. Those pregnant women who come in with COVID positive infection, they either delivered their babies normally or they've had to go through cesarean section. It just depends on their condition. But they have recovered. We monitored them for a while after their delivery in the COVID care unit. And once they're stabilized and, without symptoms, they are released home. And of course, with home isolation, because the time that they're released, their test results are still positive. So they needed to continue home isolation.
So we haven't lost any babies.
No, we haven't lost any. Knock on wood, don't jinx it.
Right. Who's the youngest COVID patient in the Guam Memorial Hospital? Not, I don't, of course, not their
How
name,
old?
but how old is the youngest?
Not recently, not in the second wave. In the first wave, I believe the youngest one was 9 months that I can recall. There may have been one younger than that, but the one that comes to mind was a 9-month-old infant that was traveling, came from an off-island trip with the parents. So, but the infant and the parents and the family were released. They didn't have to be hospitalized.
How about this round?
This round, I haven't seen, and I haven't gotten any reports that there have been, infants with positive COVID test results.
The Guam Memorial Hospital Board's scheduled to meet tomorrow. That's still.
Yes, ma'am. We have a virtual board meeting tomorrow at 5:30.
What, anything big on the agenda that we should know about?
Just an update to update the board on the COVID events that are going on and, and I know that they want to have more detailed discussion on the STIF and the SNF, the status of that, the strategic planning that, the board wants to continue, the budget fiscal year 2021 and how it's going to impact the hospital. Some of the health professionals, the doctors that need their privileges approved.
Okay.
And I think that's basically it. I had the agenda the other day, yesterday, and I can't
Okay.
recall everything that was on
But
it.
we can definitely zoom in. Just real quickly, SIF
Yeah,
is.
it's available.
Okay.
It's available.
SIF open? Yes, no?
It's open, but we're not occupying it right now.
Okay. All right.
Right.
Thanks a lot, Lillian.
Thank you, Lillian. Be safe.
But I do want to say
Yeah.
also that the DOD who are here, 9 of them are going to be remaining. The rest are going to be leaving October 1. They'll be processing out. And, it's not just registered nurses and it's not the doctors. I keep forgetting that the respiratory therapists
Right.
have been a great help. 4 of them were deployed to our facility, and they've been really a great help in the respiratory therapy department. And so, and then yesterday we received 30 tablets from GTA. They donated 30 tablets, which is going to be a great help for the physicians to do their daily rounds on the patients. And we're going to put those in the Care 3 and Care 4. And those rooms have solid doors. So these devices will provide the physicians that virtual ability to see their patients without having to go in and out that frequently. So it's a very, again, helpful
No, that's great.
technological.
Yeah. Lillian, just real quick for clarification, you said 9 DOD team members will remain. Are you talking about what you had told us yesterday? They're going to remain until October
Yeah.
3rd or
Fourth.
so?
Yeah.
4th?
Four.
Okay. Oh, so they're not
The-
extending another month. Okay.
The
They got
CCRN.
extended for 4 more days.
Okay.
Yes.
Okay.
9 CCRNs and 1 intensivist.
Right on. So thank you, Lillian.
Thanks,
All right,
Lillian.
thank you too.
Appreciate the
Take
update.
care.
Okay, Hagumas. Okay, so 9:39. Let's go right into the KUAM News Zoom room where we heard ESGR 8 o'clock hour. They normally have their big event, right? Another big event that we always have this time of year. Red Ribbon Week.